Hey everyone, my name is Austin Trellis. I'm a nursing student out of Virginia Western Community College here in Roanoke, and today I'm going to be giving a little presentation about xylazine and the emergence that is going on with it in the United States. So what is xylazine? So xylazine was first created as a veterinary drug used for pain relief and sedation in animals. It's never been tested for human consumption, and yet it's one of the main threats that we're seeing right now in the streets with overdose and drug use. And the problem with that being that it's a non-opioid analgesic and it's most commonly combined with opiates such as fentanyl. So this means that whenever an overdose is taking place, that Narcan, the antidote, is essentially not effective because you're canceling out the opiate and yet you still have the non-opioid to deal with. And there's yet to be adequate studies for treatment for that. So some importance in trending data that we're seeing right now. So in Philly in 2021, there was over 90% of the samples that were taken of the dope contained xylazine. Um, in 2019, there were only 16 states that had no forensic evidence, and just 3 years later, there are only 3 states now that do not claim to have any misuse. In 2023, Joe Biden actually declared xylazine as an emerging threat, and xylazine is one of the most common fillers for cutting drugs now, especially with fentanyl, and it furthers the quantity and potency of the drug. So it really just throws a wrench in things. So what are some side effects we're going to see with xylazine? So a big thing to remember with this is that it is a sedative and nervous system depressant. So we're going to see a decrease in pretty much everything. And the biggest thing with xylazine and everything meaning vital signs. So decreased breathing, decreased heart rate, and decreased blood pressure. And the biggest thing with xylazine is that it causes wounds to pop up regardless of injection site, even if you aren't injecting. So it basically eats the skin from the inside out and can cause some really nasty wounds. So what does this look like? This is a graphic image I'm about to show you. So this is a man in Philadelphia um, that just had taken some tranq, and you can see the wounds here on his leg. And it's not a good picture, but this is real life of the drug. So, all right. So, how are we going to treat an overdose? So, first thing we're going to do, we're going to call 911 or ask a bystander to call 911. Next thing, if there isn't naloxone present, you want to administer that ASAP. Next, you want to make sure that their airway is open and that there's nothing blocking it. Then we would give rescue breaths by creating a seal between our mouths and then giving 2 slow, deep breaths. And then if there is no pulse present, then you want to begin chest compressions. So just a little user education. We want to educate people that use to never use alone, as they will have no help in possibly overcoming an overdose if they are by themselves. You want to use testing strips on your drugs. Always carry Narcan if possible, and most places actually have a clean needle exchange programs where they will give you clean needles. And if you are planning on using, take small doses to avoid adverse reactions. So just some final thoughts. We never really want to judge anyone. It's not like these people really meant to be in this predicament, and you never know these people, and these are family to people, and should be treated as such. And we are all human, and we all deserve attention and care as much as the next person. So, just a little something to leave you with. I appreciate you listening, and hope you learned something, and I hope you have a good day. Thank you.